There are three types of strokes. The first is a TIA, which is transient ischemic attack. It's a precursor to an impending stroke within the next few hours or a few weeks. It means there's a transient disruption of the blood flow or obstruction in the blood flow to certain parts of the brain, warning you that a stroke is impending. The second type is an ischemic stroke, where there is a clot that obstructs the blood vessel, thereby depriving the brain of its blood flow and oxygen, causing a stroke. And then there's hemorrhagic, where the disruption can be because of a broken blood vessel that spills the blood into the brain. Stroke is the number one cause of adult disability, number 5th in the cause of death in the United States. The effects of stroke can be many, from vision loss to walking difficulties to weakness of one side of the body versus the other, difficulty with feeding and swallowing. So the effects of stroke are very varied and many, depending on the type of stroke that is sustained. So the treatment of strokes has evolved over the last few years. Very time sensitive for those patients who present very early on and recognize the symptoms of a stroke can benefit from being given a clot buster called TPA. There are also procedures in place that can actually retrieve the clot or suck out the clot or lyse the clot. Again, these are very time sensitive. And for patients who are neither a candidate for the first two, become candidates to be treated with an antiplatelet medication, with medications to control their cholesterol, control their high blood pressure, modify diabetes, and their risk factors such as smoking, obesity, physical activity, all of that are included in the treatment of strokes. The warning signs of stroke have to be taken very seriously. They can be anything from a transient loss of vision in one eye, weakness of the face, weakness of the arm, difficulty with your speech, difficulty walking, double vision. But the easiest ones to remember are FAST, F-A-S-T, face weakness, when you look in the mirror and you do see that the face doesn't match up on the opposite side, arm that's weak when you hold out, or leg that's also weak, speech that can be difficult to understand or difficult to enunciate or garbled, and the time to act on it is really very, very, very important. I couldn't stress the importance more than that. Recognize the symptoms of a stroke early on so you do not have to face the disability later on if you're treatment eligible. Prevention of a stroke, the extremely important aspect is primary prevention of a stroke. The risk factors that one might have, hypertension or high blood pressure, diabetes or elevated blood glucose, or exercise that needs to be on a very regimented fashion, management of healthy weight, healthy sleep, as well as a healthy diet, they contribute to primary prevention of a stroke. There are certain risk factors that may not be so preventable, such as carrying a gene or a genetic marker that increases your susceptibility in having a stroke. It's especially important in those situations that you modify the others, such as smoking, diabetes, high blood pressure, so you negate the primary genetic risk factors to a certain extent.